Welcome. This webinar is brought to you by the New Hampshire Training Institute on Addictive Disorders. You can access the recording of this webinar on our website at nahatica.org. After completing this webinar, please upload and complete the quiz if you're interested in receiving a certificate. You can find the quiz in the file pod throughout this presentation on our website, nahatica.org, or you can email us at thetraininginstitute@nahatica.org. You can email, mail, or fax the completed quiz. Contact information is on the quiz itself. If you're a member of NAHATICA or NADAC, the certificate for this webinar is free. If you aren't a member, the fee is $15. You'll receive a certificate worth 1 CE once you have completed and passed the quiz and paid for the webinar if applicable. Throughout the New Hampshire Training Institute on Addictive Disorders, this one-hour event is pre-approved by the New Hampshire Board of Licensing for alcohol and other drug use professionals, as well as the NBCC. If you have any trouble viewing this webinar, audio problems, or have any technical questions, please contact us at 603-225-7060. Please email any questions regarding the material you see today to traininginstitute@nahatica.org. And you can upload and find these introduction slides in the file pod to the right of your screen. And with that, I'm going to turn you over to Kelly Ludke to talk about Core Function 6 counseling.
Hello, everybody. Welcome to the Core Function webinar on counseling. A little bit about myself. I'm Kelly Ludke. I have my master's degree in education counseling and my CAGS in counseling, and I'm also New Hampshire licensed MLADAC, which stands for a Master Licensed Alcohol and Drug Counselor. I am a professor of human service and addiction counseling at NHTI, Concord's Community College here in New Hampshire, and I also serve as the program coordinator for the addiction counseling program. I put my work email up on the slide, so if any of you have questions, always feel free to email me and ask away. I'm here to help. Some of the objectives we're going to be talking about today. Obviously, today we're going to be talking about the core function of counseling. It's core function number 6 out of 12. And this is for people who are studying or are substance use disorder clinicians. 3 objectives we're going to cover today is 1, learning what the definition of counseling is according to the ICNRC. And I put according to the ICNRC because if some of you are watching these webinars and using the CEs towards your licensing requirements, which I'll talk about a little bit later in the webinar, the ICNRC is the one who crafts the exam that you'll be taking for your licensure. So we want to make sure we're giving you information according to the ICNRC so that when you test, you have the correct information. And the definition of counseling is a pretty general, broad type definition. And when we start to get into the specifics, we call it the global criteria. So you'll be learning about the global criteria of counseling, again, according to the ICNRC. And just as a reminder, in past webinars, I've explained the global criteria as the things you must be able to do, right? So you get a definition of counseling, and that's all well and good, but the idea with the global criteria is to be able to know how to do counseling. So the global criteria are the steps, things that you need to know on how to do the core function. And another objective, amongst a few others, is you'll be or will be discussing the personal characteristics of counselors. So what does it take to be a counselor? Oftentimes when I interview people coming into an addiction counseling program, I usually ask, so why are you here? You know, why do you want to do this work, right? There's this high burnout rate, we work long hours, there's a lot of paperwork, and people often give me, generally they give me one of 2 responses. first they'll say, I want to help, right? I'm good at helping and I want to help. And that's well and good, but sometimes wanting to help doesn't necessarily mean that you're going to be a good counselor. So we often talk about personal characteristics of counselors, and we also talk a lot about the job. The second reason people often give me for why they're entering an educational program for addiction counseling is because they're in recovery themselves. And they feel that they can, again, I guess, sort of give back and help based on their own experiences. They feel like giving back through their own journey in recovery. So generally, I say those are good starts to why you might want to get into the addiction counseling profession, but there's a whole host of other things that make a good substance use disorder counselor. And we'll talk about some of those today. So getting right into it, and some of this is a little dry, I apologize, but I'm just giving you, direct from the ICNRC, the definition, because on your alcohol or drug counseling exam from the ICNRC, they might ask you what this definition is. So it's important for you to know it. And it'll be important for you to understand the definition as we go through the global criteria and talk about some of the other components. So counseling is defined by the ICNRC as the utilization, the use of special skills to assist individuals, families, or groups. So I want to stop there for just a second. And the utilization, the use of special skills. And the reason I put a little emphasis on special skills is because remember back to the people who sit across from me and say, I want to help, or I'm in recovery and I can give back. I said that those were good beginning steps, right? Those were good reasons to be interested. Doesn't necessarily mean that they're going to be great at the job itself, because there's these special skills, right? So the passion is great to have that, but there's this whole other host of special skills that we're going to talk about that need to be in place when you start to work at assisting individuals or families or groups in achieving objectives, right? In achieving objectives, to me, are baby steps to reach a goal. And so you're going to be using these special skills in counseling to help either individuals, families, and it should really say and or groups, in achieving what their end goal is through exploration of a problem and what its ramifications might be. So you're examining attitudes and feelings, you're considering alternative solutions, and decision making. So that's a definition that might seem small in itself, but it's got a lot to it when you really break it down. And hopefully today, when we start to go through the global criteria, you'll see the breaking down of this simple definition. Three elements of counseling, which is what the definition of counseling was beginning to talk about, is one, individual. Right? People tend to often tell me in the beginning of a program for addiction counseling, I really want to work one-on-one with people, and I say, that's great. You'll probably get that opportunity to do that, but don't forget about the importance of working with people in groups, right? Peer groups. And we'll talk a little bit about the different types of groups. But the power and the effectiveness of peers in a group together, don't discount that. It can be extremely powerful for people to hear feedback from their own peers versus from someone they view as the expert, right? So that's usually the counselor, whoever's leading the group. And then the third one is counseling families, couples, and other SSOs, I should say significant others. Okay, so TAP 21 is a publication put out by SAMHSA, which is the Substance Abuse Mental Health Services Administration, and it also has information that runs parallel and correlates with IC&RC's core function of counseling. So I think it's important for us today to look at both definitions and see how they do overlap. I don't really see them conflicting. They just sort of talk a little bit more about one aspect than the other. So the TAP 21 definition is a collaborative process. And I gotta stop here and again add my 2 cents that collaborative is so important. When I see collaborative, I think to remind people that working with a client, whether it's in a counseling situation, educational situation, a referral, case management situation, collaborative means there's more than one person working towards that goal. You're mutually working together to get to that end goal. So it's not the counselor saying, this is what you're going to do, or this is what I think you should do. It's more of a, okay, to the client, what is it you would like to achieve? What are some of your ideas around getting there? And working together back and forth. So a collaborative is like a give and take, right? I'm going to give you a little bit of what I think from my expertise, and you give me a little bit of what you think you can do. What's realistic right now in your life to do. So collaborative is a word I often stress because it's so very important, especially when we're talking about treatment planning and counseling. So a collaborative process that facilitates the client's progress toward mutually determined treatment goals and objectives. So this beautifully says what I maybe uneloquently just said, which is 2 people working together, right? It could be 2 or more people, but at least 2 people working together to get to the end goal. And the objectives, remember again, are those baby steps, how we're going to get to the goal. Counseling includes methods, right? So methods or techniques that are sensitive to individual client characteristics and to the influence of significant others, as well as incorporating the client's cultural and social context. So super important that we're always looking at where's this client coming from? What is their upbringing? What is their background? What are their beliefs? What might be maybe their religion, their ethnicity, their spirituality? How does that play in to the techniques that we're going to ask them to use, remembering that we put our own sort of personal cultural beliefs or preferences on the back burner and refocus on the client's individual culture and social context. Competence in counseling is built on an understanding of, appreciation of, and ability to appropriately use the contributions of various addiction counseling models as they apply to modalities of care for individuals, groups, families, couples, and significant others. So there's that piece again about how counseling is incorporated for individuals, groups, or family, couples, and significant others. I think that was pretty self-explanatory. And we're going to talk more about competency in counseling in theory and technique. And I don't want to jump ahead of myself, so I'm going to keep going, but we'll get back to that. Okay. Counseling is at the core of treatment. Yes, counseling is at the core of treatment. That's usually the place every student of mine, the minute they graduate, and even before they graduate, they often say, when do I get to do the counseling, right? They always see that as the most important part. And I have to encourage people that, yes, although counseling may be at the core of treatment, it doesn't make it any more important or less important than any of the other core functions. It's very important to realize that each core function has its role, has its place in how we do our work as substance use counselors. And I know everybody likes to just say, well, have somebody else do the intake and assessment. I can't wait to just get in there and start doing this counseling stuff. And I say, be careful. Be very careful there, because the information you get at intake, the relationship you build at intake, the rapport you get at intake, the trust you get at intake is going to carry through all the way to counseling. So from the very first step of, let's say, screening, all the way through till you get to counseling, you're building relationships, you're building trust, you're building rapport. And so by the time you get to counseling, hopefully this person is feeling much more comfortable with you. They've gotten to know you a little bit better, and they're more willing to perhaps trust the process and respect you as a clinician. So although counseling, yes, is at the core of treatment, each core function has its role and its place of importance in the process. Counselors' primary tasks. When I think about this, I often think about, again, I guess I go back to students that are new in substance use addiction programs, things like that. And I'll say, well, why are you doing this? You know, what tells you you might be a good counselor? And people will say, well, my friends always come to me for advice. Or my friends always come to me because I'm such a good listener. I say, that's great. Those are great characteristics to have, I suppose, but they don't, again, necessarily reflect what counseling is, right? And I think we already know, but it's worth stating again, counselors do not give advice, right? Counselors listen, absolutely. So if you have those really good listening skills, super, right? You're on the right track to having some good characteristics. But the advice giving is not part of counseling. And I often explain this in the sense of, I think advice might be a place better suited in the peer-to-peer relationship. So some of you listening might already be certified recovery support workers, or you might be recovery coaches, and that's a place, that's a relationship, that's at the heart, really, of peer-to-peer work, is talking about your own experiences, giving feedback around what's worked for you, what hasn't worked, what resources are available. So that self-disclosure piece is important in that peer-to-peer relationship. When you start to build a clinical relationship, that is not at the heart of what we do. We don't give feedback necessarily about our own recovery, what's worked for us, what hasn't worked, that kind of thing. Right? We're coming from the theory, technique, clinical aspect instead of a peer-to-peer role. So it's important to remember that counselors are not giving advice, right? We're not saying you should do this. We might try and gently lead them to explore another path, but we would never say you should do XYZ. We might say something like, have you ever considered XYZ? What does XYZ mean to you in your recovery? And that's more of a guide, right, which is one of the primary tasks of counselors. Another one is motivating them, right, helping to meet them where they're at, keep engaging them in the therapeutic process, and helping them believe in the self-efficacy piece, helping them believe that they can do this, and which leads nicely into the empowering of our clients. That you can do this. Don't always believe what your past behaviors have showed you, right? Believe that you can do this next piece. Believe that you can achieve recovery. Believe that you can get to maintenance in your recovery. Believe that you can take that one step, perhaps going to a self-help meeting, right? So really helping to empower them, motivate them, and guide them. And counselors always work to assist the client in identifying and resolving problems that interfere with their life. I see a lot of this happening long before counseling takes place, perhaps in the assessment core function, where you start to get background information on them, and that helps to start identifying what problems are actually interfering with their life. And sometimes the counseling is the piece that comes in and helps clients work towards a resolution to those problems. So I often see identification of problems in assessment, and I often see counseling as resolving or working to resolve those problems that are interfering with their life. And one sort of caveat to this is that generally when I'm doing an assessment or like a biopsychosocial, I like to ask clients in their own words, what are your strengths, right? And what are some areas that you struggle with in your life? And I think this is an area where you can empower. I think, sadly, a lot of clients have a hard time coming up with their strengths. They'll give you a whole long list of areas that they're struggling with. And then when you say, well, what do you do well, right? What are your strengths? They often struggle with that. So that's a place where you kind of want to motivate and empower and say, even being good at selling drugs is a strength, right? Even though in your mind or their minds they're thinking, well, selling drugs is illegal. How can that be a strength? Well, think of the business side of the selling, right? Think of, you know, being organized with it, or how they approach clients, or that kind of thing. So even though it seems weird to look at selling drugs as a strength, it often takes a certain type of personality, some charisma, and those types of things can be strengths. You would obviously try and encourage them to use that charisma or that business sense in a more positive, productive, legal way, but it can be a strength. So that's kind of an example too about motivating and empowering clients to identify strengths when they're feeling like, I don't have any strengths, right? My life is in the toilet and I don't really see anything good about it. So identifying in their own words what their strengths are and where their, areas of improvement are can really help when you start to work in how you're going to resolve a problem. You want to help the client take that strength and apply it to how they're going to resolve the problem, right? We'll talk about that a little bit further. I think I jump ahead of myself, so I just start talking on and on. So here we are. Counselors are the catalyst in the client's effort to change. I think that's a powerful statement. I think often we can help or we can hinder a client towards their effort to change. How empathic are we? How real are we, or genuine? How non-judgmental are we? And I teach this class at my college and another college, and I have this great video, and it shows this client talking to a counselor, and the counselor asks, when's the last time you used? And the drug was Percocet. And the client very calmly said, about an hour ago. And the counselor immediately goes, oh, wow, like really surprised that the person sitting across from them had used drugs an hour ago. And I really try and make the case that, and then the counselor goes on to say, it's really important that you show up here sober. It's really important that you're always honest with me. So the whole conversation is just really awkward and weird, and demonstrates to me that the counselor really didn't have a lot of empathy and awareness that perhaps this client was using just to stay out of withdrawal. So that could be a huge barrier when you're looking at the genuineness, the empathy, the non-judgmentalness. When you're working with clients, if you start to show judgment, like, hey, you can't show up here under the influence, then the client's going to say, well, fine, I'll go use and not show up here. Or they could say that. So you want to be really careful about that. And also remember, clients might not be using just to be disrespectful of your counseling session. Some of them just don't want to go into withdrawal, perhaps, while they're meeting with you. So they use a little bit to try and stay out of the withdrawal or not enter the withdrawal. So now we're going to get into characteristics of the effective counselor. So remember my example at the beginning of the webinar about I want to help, or I'm in recovery myself and I'm going to give back, right? Great. It's great to have that passion, but there's a lot more to this, to becoming effective in your work. The effective counselor knows his or her capability. She or he needs to recognize that when they're dealing with a client's problem that requires the expertise of another professional. So I categorize this as competency, right? You have to be able to know, whoa, this is outside my scope of competency. Whoa, this is outside my knowledge. Or whoa, I am not trained in this at all. I need to look at another person's who has the expertise to help my client with this. And that person may be in the same agency as you, so it might be a really easy referral. It might be somebody outside your building. But just knowing, okay, this is something I can't professionally treat because I don't have training or expertise in it, I have to make a referral, is a huge first step. A common example of this that I give to my class a lot is, I'll ask them, what if a client says to you, I'm feeling sad, I'm crying a lot, I'm not eating like I used to, I'm not sleeping like I used to, I feel hopeless more often than not, I feel like I can't do anything right. And as soon as I start to list these characteristics, I say, what's happening? And everyone in the class says, depression. And I say, okay, well, how many of you are a mental health therapist? And of course, nobody raises their hand. And I say, well, so does that mean, how can all of you say that that's depression when none of you are an expert? So there's a difference between recognizing a client's problem, a client's symptoms, a client's issues, and treating. So, it's important for you to know what the symptoms of depression are, so that when you hear them coming up, you go, oh, this sounds like it could be depression. I should probably get the expertise of a mental health professional to assess it and look at possible diagnosis, right? So you're not the expert. You don't have to treat the depression, but you do have to have recognition of, that sounds like it could possibly be this. And then, but knowing at that point, oh, I'm recognizing something that's outside my scope of competency. Now I need to do something about that, and that's making a referral. The second effective counselor characteristic is modeling authenticity, right? Authentic, real. I think in all of my years of doing this, I have to say the client that sits across from me with addiction concerns is one of the most intelligent, smartest person I've ever met. And I don't know to this day that I've ever seen a clientele, I should say, so astute at recognizing when you're not being real, when you're lying to them, when you're holding back information from them. And some clients will call you out on it, and some clients will just say, phony, and not come back. So it's very, very important that you are real in your sessions. And I often say counseling is this beautiful mix of science and art. And the science is obviously the clinical skills you're going to learn, right? It's those core functions. That's the science, right? That's the evidence-based science behind it. And the art is what you bring to those counseling sessions. The art is who you are. It's your style. It's your sense of humor. It's your approach, right? It's you being a real person in the room with another person and being real. And I think that's where that authenticity comes in. Don't try and be somebody that you're not as soon as that door closes and you start to do counseling with somebody. Be yourself. And when you don't know something, say you don't know something. When something is outside your scope of competency, say it's outside your scope of competency. Clients are going to respect the authenticity, the realness of you, so much more than if you try and pretend, you're somebody else. If you try and pretend, if you try and model a counselor you once had as a kid that you liked, that's not always going to work, right? You might take some aspects of what you liked about that counselor, but you got to bring yourself. You have to show up. That's authenticity. And it sort of molds a little bit into the being genuine in the therapeutic process. And genuine, I feel, is often synonymous with authenticity, this sense of realness, right? Genuine is, you can't fake empathy. You can't fake sadness, right? I think that's when our clients look at us and they read us and they know, hey, phony. So you got to be able to show up, be real, be genuine in your responses, and be genuine in what you know and what you don't know. An effective counselor provides opportunity for a growth-enhancing person-to-person relationship. I feel a lot of that, again, this person-to-person relationship. You can't be a robot. So in my classes, sometimes we talk about, if a client asks you, are you in recovery yourself, right? And if you've been clinically trained that you don't self-disclose, and instead you get to what the real clinical issue is. Why is that client asking you if you're in recovery or not? People say, well, how do you say that? And some students will say, you tell them, I can neither confirm or deny that. And, I'm sorry, but I roll my eyes to that. I really do. I don't see that as a person-to-person relationship response. That's robotic. It's removed, and not something I feel has its place necessarily in the counseling relationship as it pertains to, are you in recovery, right? If they want to know something about you. So I think that's a good example of, don't turn into a robot just because you find yourself perhaps in a situation where you're not sure, you get caught off guard. You're not sure how to respond to, are you in recovery? Your brain's just telling you, don't tell them, and then it falls back on what you learned perhaps in an ethics or confidentiality class, which is, I can neither confirm or deny. But remember, self-disclosure, number one, is not a confidentiality issue per se. Perhaps it is the client being concerned about whether you're going to judge them, whether you're going to understand them, whether you're going to be repulsed by what they're telling you, what some of their behaviors were while they were under the influence, or some of their behaviors when they weren't under the influence. So I think when you're in this person-to-person relationship, you need to look at a question, for example, like, are you in recovery? And you need to ask yourself, why might this person be asking me this? What are they concerned about? What might they be fearing that makes them ask me this? Is it really important for me to say, yes, I am in recovery, or no, I'm not in recovery? Or is this person really afraid of something? Are they afraid I'm going to shame them, guilt them, or, a whole host number of reasons why they might be asking that. So a person-to-person relationship, you don't put on this robotic, I can't confirm or deny. You start to get into what might you be experiencing right now? I'm wondering why you asked me that question. I'm wondering if you're afraid of something. I'm wondering if you're afraid I might judge you based on the things that you've done if I'm not in recovery. I'm wondering if you think I'll understand you better if I am in recovery. So that would be more of a person-to-person relationship, right? Treating the person as a human being, looking at them as a person versus file, a chart, just another number. Um, the next characteristic of an effective counselor is willing to look honestly at his or her own life. So I guess I look at this characteristic as walking the walk and talking the talk. Um, so don't get me wrong that, and this is just a small example of this. I think there's many other examples, but when I look at this, I think, okay, here I am, and this I'll give you one of my own real life examples, which is when I first began counseling. I worked with college students around high risk behaviors, and I would often ask clients during the interviews and the assessments, yeah, of course I asked them if they use drugs, do they drink alcohol and how much, all that. I'd also ask them about smoking nicotine, because at the time they didn't have Juuls and vapors and all this stuff. It was just cigarettes and nicotine. And, clients would often say, or students would often say, yeah, I smoke a pack a day, right? Or I smoke half a pack a day. And I was then instructed, to launch into well, how willing are you, to change this behavior? Do you know what the consequences of smoking nicotine is? And et cetera, et cetera. And then I would get my break and I'd go outside and I'd smoke 3 cigarettes while I was on a 15-minute break. And it got to me. Honestly, it got to me at one point and I thought, I am such a hypocrite. How can I sit there and give this speech about the dangers of nicotine and give them information about how to quit and really try and motivate them and empower them and, all the stuff I was taught in school and all the stuff you're learning in this webinar today. But yet, as soon as I get my free time in my own life and my own personal decisions, here I am, choking down as many cigarettes as I can in 15 minutes. So I have to look honestly at myself about, is this who I want to be? Is this what I want to represent? Am I okay with being a hypocrite? And I said earlier when I started this example that it's one of many, and I don't want people to get the wrong idea that, you can't drink alcohol if you're an alcohol and drug counselor. You may certainly drink alcohol if you're over 21 and you don't have a problem with alcohol. You don't abuse alcohol. So you're not a hypocrite, if you safely and responsibly drink, one standard drink in a week, or whatever it is you do, as long as you're, it's legal, you're of age, and you don't have an issue with it, right? That's, I just, I think often when I give that example, people think, well, I can't, drink if I'm an alcohol drug. Well, that's your own choice. You have to look honestly, I guess, at your own alcohol use and determine if it impacts or if it's a problem, and what you want to do about that. One of the last ones on this slide is willing and able to make health-promoting personal choices. So I kind of combine this with the one above it because I think it's really important that we do walk the walk and talk the talk. I don't think we should ever give our clients information or education that we're not willing to take ourselves. And I think that rolls beautifully into authenticity and genuineness too. As part of being a person too. To this day, whenever someone talks to me about, quitting cigarettes or whatever, I'm like, oh yeah. I totally give the empathy nod and it's tough. I don't share how tough it was for me. I don't go into the process I used. I don't even disclose that I am addicted to nicotine. I just empathize, right? I'm just there, like, it's got to be tough, right? So I think it's most important when, working with people with addiction issues is so much more than just the thing they're addicted to, right? It's their social relationships, it's their family relationships, it's their education, their spirituality. I mean, it's all encompassing. And I think sometimes we have to look honestly at our sort of biopsychosocial history and say, am I making good choices, right? Am I being the person that I'm asking and talking about with our clients? my asking them to be this person that I won't even look honestly at my own biopsychosocial habits or history, and am I willing to make these health promoting personal choices in my life? In red, I have down there, I really do believe this. It says a counselor can assist the client to grow only to the level of health she or he has reached. And I like this much, why it got its red in this PowerPoint is because I believe you can only take a client to a level you have reached. And what I mean by that is, this isn't to say that new counselors can't take clients to levels of health that are just beginning levels. I think what it means is based on your own life experiences, what you've gone through, what hard work you've done in your life, what self-awareness, self-growth you've done in your life up to that point is about as far as you can take people, because you don't know what you don't know. I think that's sort of what I'm trying to get at with that, which is why it's so important to continuously ask or work on your own self-growth, right? Once you stop growing, you die. So you're constantly always working at something. That doesn't mean you're always in a state of crisis. It means that there's always new things to improve upon. And some of those improvements might be big, drastic changes, and some of them might just be little baby steps you take every day, every hour, every minute towards being the best you or being the best person you can possibly be. So I think the reason that gets read and deserves a little attention is an effective counselor never stops growing, ever. They're always looking at their self-growth, their self-awareness, their self-actualization. More personal characteristics of effective counselors. Having presence, right? All of us have presence. We all walk into a room and people feel energy from us. That's presence. And some of us have real strong presence when we walk into a room. Some of us have more softer, gentler presence. Your presence is your presence. It's your energy, and everybody's going to respond differently. So some clients are really going to respond to a strong presence. Some are going to want that more subtle, softer, more quiet, reserved presence. So sometimes if it's not working out between you and a counselor, a client, that might be a simple matter of presence and identity, who you are. Which leads into number 2, have an identity, right? Respect and appreciate yourself. Recognize and accept your own power. Always be open to change and expanding awareness of self and others. So these characteristics are from Corey and Corey, a textbook I referenced at the end. So they sort of have the same elements of the ones we've just been talking to, which is why I went through them a little bit quicker. It's just put in a different way. So some of you might respond to the way Corey and Corey puts these personal characteristics, and some of you might have responded more to Tom Durham's characteristics of effective counselors. More personal characteristics, tolerating ambiguity. Being able to sit when things are unknown. Being able to sit with things when you don't know. Being able to sit when things are out of balance, right? That's important. Developing your own counseling style is something we're going to sort of talk about today. We're just going to talk about the beginning steps towards developing your own counseling style. So I just want to say, even though this is the core function of counseling, this is not designed to be an individual counseling course. So for some of you, that might be a really important part of your education. If you really don't know theories and techniques, it might be worth investing in a type of individual counseling course. But we'll talk about the importance of having your own counseling style. Personal characteristic of an effective counselor: experiences the world of the client, yet remains centered. So I often think about empathy with that. I think when I'm listening to a client sometimes and they're telling me, about some of their difficult experiences or maybe some of their life traumas, I really feel myself walking the journey with them. I try and walk the path with them. That's how I often describe empathy. I feel like I figuratively take the client by the hand and I let them guide me through their own words to their experiences, how they perceive their world, how they perceive these experiences. And I ask questions along the way. They might be walking me down the path and they're talking about something, and I'm like, well, tell me a little bit more about that, right? So I actually do a lot of visualizing when I'm working with clients that are talking about their experiences because I really want to understand it. And sometimes I have to just ask a couple clarifying questions as we're walking the journey together. But at the end of the experience with the client, I have to somehow come back out, right? So an example is sometimes when clients might be talking about a life trauma and I'm really experiencing it with them. I'm walking that journey with them and I'm feeling what the experience must have been like for them. I can't get lost in that feeling. I have to remember that I'm the guide, and I have to then, after they're done talking about the experience, bring them back. And I do that by staying centered myself, right? So I've heard some really terrible trauma stories in my career, and I feel really sad and vulnerable and scared sometimes after listening to these experiences. But somehow I have to come back out of it. I have to be back to being centered and grounded. I can't just fall apart in a counseling session because I've really empathized with what the client has said and I really have felt that journey. I have to be able to say, okay, I'm there, now I got to come back, right? So how does one experience the world of the client yet remain centered? And that's going to be different for all of you. Feeling alive and your choices are life-centered is important. And again, this authenticity, being sincere and honest. So some of them are a little repetitive, but I think they deserve a little extra time, right? And talking about those and really pointing out the importance of authenticity, sincerity, and honesty. Have a sense of humor. This job is hard. And life has been hard for people, and life may have been hard for you, right? You can't walk around letting those things bring you down and be a sad sack all your life, right? You have to try and find humor in things in your life, and outside of your work. And don't be afraid to appropriately make an appropriate, joke or something with a client. That's okay. You got to be really skilled in when to make that joke to lighten the mood or something. I mean, you obviously don't just bust out a joke about someone's trauma history, but sometimes, adding an element of your own humor into the counseling relationship really brings that human piece to you. It brings that genuineness, that authenticity to it. And so does willingness to admit your mistakes. If I could say anything about this, it would be, please don't ever pretend to know something that you don't. It always comes back and blows up in your face. It's so much easier to just be forthcoming and say, it's a really good question. I don't have the answer to that. Let me do some research. Let me ask some colleagues. Let me find the answer for you, and I will get back to you. And make sure you get back to people, right? If you promise something, deliver on it. Living in the present, right? I like to talk about experiencing or practicing mindfulness in our lives, right? Don't go too much in the past. Don't think too much about the future. Experience the joy of being alive right now. And I think that's important because this work can certainly get you down if you let it, right? If you don't have that good self-care happening, if you're not present right now, if you're constantly stuck in what happened last week, last year, 10 years ago, or you're constantly worrying about what's going to present itself in the future, you're not in the present, and it's going to make an already hard job even harder. Appreciate the influence of culture, right? So we already talked about that a little bit, making sure, uh, you're not putting your own culture, your own beliefs and morals and values into the relationship. Don't be afraid to reinvent yourself, right? Who you were. Some of us, it's a really good thing that we're not who we were 5 years ago, but some of us do need, a whole overhaul on ourselves. Some of us just need to make little tweaks here and there. And making choices that shape your life to be the life that you want it to be, the one that you're proud of, the one you're meant to be, that authenticity piece. You have to have sincere interest in the welfare of others. I generally never see that lacking in all the addiction counseling students or human service students I've ever had in a classroom. Nobody has ever not had sincere interest in helping people get better or making sure their lives get a little bit better. I think a lot of you might have different motivations for that, which is something to explore. But a lot of you have this sincere interest in just making the place, the world a better place to live, and hoping people treat people better or that they can live fulfilling, happy lives. Become deeply involved in your work and derive meaning from it. This statement does not mean become a workaholic. This statement does not mean work more hours, have more clients, and do more things and do more voluntary work than everybody else in your agency. This means learn as much as you can about this work. Constantly get training. Constantly go to workshops. Even if you've been to 600 ethics trainings, try and go to 2 a year. And you might hear some of the same stuff. Great. You've heard some of the same stuff. You're on a good track. Perfect. You might learn something new. You might get a fresh perspective. You might be able to help somebody else that's in that training understand something. But make sure you're constantly fresh, learning new things, learning new techniques, learning what the new advances are in our profession, because it is changing all the time. Right? There's always new evidence-based, science-based approaches coming about. And derive meaning from your work. Why do I do what I do? And that should be changing all the time, right? As you become an experienced clinician, as you learn more about the practice, as you learn more about clients and how clients change and why clients change or don't, right? You're deriving meaning from your work. And I probably should have put this with exclamation points all over it, but maintain healthy boundaries. And what I mean by that, I think, is have friends outside of work. Have activities that don't involve work. Take vacations. Understand your role as a clinician, as a counselor. It is not a peer-to-peer role. You're seen as an expert to these clients. It's a professional relationship. You're not friends with your clients. You don't have intimate relationships with your clients outside of work or in work. You don't have intimate relationships with them. Take care of yourself so that you can keep these boundaries in place. I often talk a lot about I already said having friends outside of work. I think this is really important. I think what happens is you spend a lot of time at work, you become close to people at work, and all of a sudden you're hanging out after work with them, you're hanging out on the weekends, and you guys find yourself sort of always talking about work, right? And that's not maintaining a healthy boundary, right? So have friends at work, that's fine, right? Have good, healthy relationships at work. But when you leave work, hang out with people who do something completely different than you. right? Hang out with some accountants, I don't know, some lawyers, some carpenters, all types of different people. And that helps keep things fresh. It keeps you away from work a little bit, might turn off the brain for a while, and helps you to maintain those healthy boundaries and remember the power differential in your professional relationship. Global criteria. So this is how to do the work of counseling. And the first one's to select the counseling theory or theory that applies. So we're going to talk very, very quickly today about theories because, as I said, this is not an individual counseling theory class. You're going to learn about some of the techniques that theories often use to assist clients, groups, or families in exploring problems and ramifications, and applying the technique to the client, group, or family in examining clients' behaviors, attitudes, or feelings, if appropriate, in the treatment setting. We'll also talk about how you individualize counseling in accordance with cultural, gender, and lifestyle differences. You have to be able to interact with the client in an appropriate therapeutic manner. You have to be able to elicit alternative solutions and decisions from the client, right? So not one solution works for every single client. You have to think outside the box sometimes. And you have to also remember that counseling is not a fit for everybody. So if counseling is not working for a client, what other solutions could the client possibly seek in order to help with their issue? And counseling involves implementing the treatment plan. So here's an example. I'm going to go very quickly through these. So some examples of counseling theories. Some of these are probably familiar to you. You've at least heard of them. I wouldn't expect all of you to be experts in these by any stretch, although some of you might be. But popular ones that you may have heard include psychoanalytic, person-centered therapy, gestalt therapy, rational emotive behavioral therapy, or REBT, reality therapy, behavioral therapy, and cognitive behavioral therapy. So those are just, as you start to explore or you take a class on theory, you're going to see these in if you take a psychology class or an individual counseling class, you're going to really explore these in depth. So I've already talked about that this presentation is not a course in individual counseling theory. So if you were hoping to get to the bottom of what psychoanalytic theory is, you're going to be disappointed because that's not what this is about. I really believe all of you should invest in taking an individual counseling course, however that looks, right? You can do one online, you can do one through training institutes, you can take one out of college, but it's definitely worth the investment if you feel like you really just don't know any theories or you haven't quite found one that you can identify with. Counseling theories, best practice in the substance use disorder treatment profession identifies cognitive behavioral therapy as the theory promising efficacy. It works. So it's more of a short-term type behavioral theory that has shown a lot of it's shown a lot of, what word am I looking for? Efficacy, but it's proven to work well for people suffering with substance use disorders. But that certainly doesn't mean that other theories are not effective, right? The research is just showing that CBT is one of the more common approaches that substance use disorder clinicians use because it works well, right? Clients respond to it. I have to mention eclectic, and I put UGG there because it's one of my little pet peeves, and we'll talk briefly about this, but eclectic is not a theory. It is not a theory. It's not a theory. Try and say that 100 times. So a lot of the times I'll ask students typically, or entry-level counselors, what theoretical orientation do you have? And they'll say, well, I'm more eclectic. And that's where inside my brain and inside my gut, I go, ugh. Because the word eclectic commonly means one of two things to me. And one is that the person who says they're eclectic knows a lot of theory and their applications, but have mastered none of them. And the second thing that I hope for each of you is that the counselor knows a few theories and their application and knows when to use what theory and which technique when presented a problem. So typically a counseling student, a novice counselor, has what we call theoretical orientation, and they're more trained in a specific theory and technique. It doesn't mean that that one theory, those few techniques, apply to all people. It's good to have a few theories and a few different techniques in your clinical toolbox, but most of you are going to, as you go through master programs, you're going to get trained in one theoretical orientation, but you might also learn along the way a couple other ones, right? And that's sort of my wish for all of you, is that you're trained extensively perhaps in one, but you also know, a couple more theories in their applications and their techniques, and you know when to properly use them with different clients and different issues. It's important to know what the research says and apply the best practices. And make sure you're always looking at the research in addiction, identifying best practices. Okay, time for a discussion question. True or false? Eclectic theory is a counseling theory. Boy, I sneakily put that one there. Hopefully you all get it right. I won't give you too much time here. Eclectic theory is a counseling theory. True or false? False. Just look at our previous slide and go back on our conversation, right? It's not, it's just something that people often say. Well, yeah, I know, I believe in a lot of them. Well, that's not a theory, right? It's okay to have more in your toolbox, but what are you actually trained in? Tip 34. So I'm not going to talk a whole lot about this, but I put a little picture of it. It's a publication from SAMHSA, right, we talked about earlier, on brief interventions and brief therapies for substance use. I'm so used to saying substance use now that seeing substance abuse looks weird. So the DSM-5 language is currently substance use disorders, but the old DSM-4 language is substance abuse. That's where that comes from. 12-step work of AA is not a theory. Super important. Self-help groups can be good supplements, but they're not theories. You don't approach the problem with self-help, right? Self-help is something that works in conjunction with therapy. Global Criteria 22 is applying technique. So in John Herdman's book, The 12 Core Functions of the Substance Abuse Counselor, he gives this little chart of different types of techniques that counselors might explore when examining a client's problems and its ramifications. So I just wanted to give you some, and you can certainly look into these more, but I wanted to give you some examples of some of the techniques often used in our work. You should know multiple examples of techniques, right? Don't just know the empty chair technique. No journaling, no or monitoring cards, no journaling, no different things, because clients are all going to respond to different, I've had one client say, don't you dare tell me that I have to journal because I hate journaling. Well, if you hate journaling, perhaps I need to, go back to the clinical toolbox and pull something else for you. Maybe the empty chair would work better for you, or their shoes technique, right? Trying to put yourself in somebody else's shoes. So you got to know what the techniques are used for, how the client would come to know the technique. So that means you got to educate them. It's your job to educate them on the technique, why it would be helpful, how they do it properly, how often they should do it, etc. And then you often show the technique in counseling with the client so that they get to sort of role play it a little bit with you and understand it. Here's some techniques for clients in the action stage of change. So again, these are just examples, things for you to kind of look at. In the top 21, domain 5 addresses counseling. And this is, again, all stuff that I think lines up and parallels with Herdman's work on the 12 core functions. So I'm going to kind of go right through this very quickly because we've already discussed a lot of this. Now let's get a little bit into group counseling. Groups are really significant for clients because they often represent the client's real world. So putting a client in a room with their peers, peers that are going through some of the same problems, some of the same experiences is often really helpful for them. It's representing their real world, something they can understand. It can bring diversity in interpersonal interactions. Clients often learn new behaviors by observing others successfully role modeling it. Peers teaching peers is so effective. I really can't stress that enough. So maybe a group might be a good supplementation to individual. And groups give clients the opportunity to practice their new skills in a safe environment, right? Everybody's in the same boat, so they're able to practice and role play with one another, and nobody's the expert. Groups should be supportive, have a sense of camaraderie, acceptance, and emotional closeness. And they provide a way to prevent unhealthy self-centeredness. They learn to give and take of life. The functions of a group: learning behavior by observing the behavior. They get to practice that new behavior in a safe environment. And that's your job as the counselor if you're running the group, right? To make sure that this group is safe, people can practice a new behavior without feeling judged, to develop emotional closeness, and receive feedback. You know, once you role play something, somebody can say, you know, great job, these are the great things that you did with this role play, and here's some areas, or here's some feedback or suggestions that I might do differently in order for this to work properly. There's different types of groups: the group therapy, group counseling, personal growth groups, T groups, structured groups, and self-help groups. Most of you are probably familiar with self-help groups. That would be your AA, your NA, Al-Anon, things like that. Group therapy, typically the target population of group therapy is clients with psychological problems and/or psychosomatic disorders. Therapy is often remedial rather than developmental or preventative, and attention is often given to unconscious factors, so past experiences with growth and development of the client's personality. Group counseling, on the other hand, the target population includes substance-using clients, for sure. Focuses on developmental, rehabilitative, preventative work, the emphasis on problems in daily living. The group is generally oriented toward finding solutions to short-term problems and issues, and it's less addressing of unconscious issues, and there's no major attempt at personality reconstruction. Personal growth groups, right, focusing on participants making changes to the patterns of their thinking, feeling, and acting, that sort of cognitive behavioral piece. The ultimate goal of participating in a personal growth group is for the client to function more effectively on an interpersonal, intrapersonal level. And it's for fairly healthy individuals who wish to explore personal issues that are not pathological. So we might call those like adjustment disorder type things. T groups are training groups or laboratory training groups. People that would go into a T group are usually healthy individuals, and they address specific topics geared toward the more successful functioning of a business, an organized group. So they're really task-oriented, and they do not focus on personal issues. Structured groups have a time limit, somewhere usually between 4 to 15 weeks. They have a specific theme, and they provide participants with increased awareness and skill in a specific life problem. So a self-esteem group would be a structured group that's 10 weeks long. There's usually an assessment tool to make sure that the person actually fits the criteria of being in this group. So stress management or assertiveness training are two examples Tom Durham gives. discussion question time. So, groups are significant for clients because they represent the client's real world. True or false? The answer is true. And you can go back to slide 25 for reference there. And you all know self-help groups. They're peer-to-peer relationships. Their purpose generally is to bring care, hope, and really to bring support. They usually focus on a specific problem like alcohol use or overeating or gambling. And they're not conducted by a counselor or professional, but by somebody who's been successful in recovering from the issue of the group. Okay, then we have references there. Check those out. Well, it has been a pleasure spending the last hour with you. Again, I have my email on the first slide there. Feel free to email me with any questions that you might have. And I really appreciate your time and attention to this core function. Again, my name is Kelly Ledke, and I'm signing off now.